Well, with a number of states coming out of quarantine, AgriSafe highlights the need for safety precautions in rural communities. Not only do these areas have different health risks and a generally older population, they also continue to face a healthcare shortage. AgriSafe Intern Emma Bergqvist joins us now with the latest. And Emma, thanks for taking the time to chat with us today. So what are some of the biggest risks facing these rural communities amid the pandemic?
Hi, thank you for having me. So the rural areas are definitely at a higher risk, and this can be due to a lot of different factors. As you mentioned, they're generally an older population, and they have higher risks of smoking and diabetes, which are all associated with higher fatality with COVID-19. But they also have a lot of these areas have healthcare shortages, which means they might not have as high of a threshold of ICU beds, or the means to take care of the people who might get the virus when the virus hits, which shows that they will have a higher case fatality rate when it does come to those areas.
So with states now starting to come out of quarantine, is there a chance, are you expecting to see a second wave?
Yes, definitely. The more people are out and about and the more they have contacts, the greater chance that it will spread and consequently a second wave of coronavirus. But the good news is that a lot of these places are much better equipped for this than they were a month ago, although rural areas we're still pretty worried about.
So is there anything done that can be done to try and prevent or at least very much reduce a secondary wave?
Absolutely. There's a lot of things that can be done right now. One of the best things that we can do is contact tracing. And this is something that can be done on a government or a grassroots level. It was used in South Korea to combat coronavirus, and it's been used in a lot of other infectious diseases. And if this is going to be successful, we're going to need a lot of people doing this, almost 200,000. But the good news is also there's a really good bit of push for federal funding to come to this project. So it's looking good. Like there might be a decent amount of effort going towards that way. And AgriSafe is actually doing, they've done a lot of webinars over the past couple of weeks. So if you go onto their website, you can go on there and look at their past think tanks. And we've done a lot on contact tracing and other solutions to help prevent coronavirus spread, a second wave, and how to help temper the current waves that we're in.
So what is your message to rural residents?
I think the best thing to do is just to stay safe, recognize that if you think you have coronavirus and it's a mild case, stay away from the hospitals to try to prevent any hospital-acquired infection. Continue doing the distance, try to prevent any sort of unnecessary spread, and just be cautious because, these are areas that are at high risk, and they're the heart of America, and it would be really devastating if these areas are ravaged by coronavirus.
Emma, do you find or do you know if more testing kits are available in rural communities now than what were maybe a week or two ago?
I'm not sure on that exactly, but I'm sure as time goes on, the more tests will be available, the better testing will be available, just as it is, it'll become more developed. And as time passes, the better chances we have of getting better tests and better equipment for that.
All right, Emma, thank you very much for your insight again. Emma Bergqvist, she's with AgriSafe, joining us on the phone today from New Orleans.